Hello, my name is Joy Ashby Cornthwaite, and I will be your host for the 27th episode of the live stream show, My Diabetes HQ Live. Today, our guests will discuss the importance of preventative care, especially during the COVID-19 pandemic. Ophthalmologist Dr. Victor Gonzalez will share new therapies that can reverse and protect against vision loss. Serena Valentine will share her experiences with eye disease while living with diabetes, and Diabetes Educator Lisa Golden with the Texas Workforce Commission joins the conversation as well around valuable learnings arising from experiences this year. Stay tuned. Today's episode is coming up right now, and you don't want to miss this. Before we begin, a gentle reminder, the content shared during the My Diabetes HQ live broadcast is not intended to be a substitute for professional medical advice, diagnosis, nor treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding diabetes or any chronic disease. This weekly broadcast is developed and produced by Cities Changing Diabetes volunteers in Houston and Philadelphia. Our two cities are the U.S. members of a global network of 36 cities working to improve diabetes prevention, care, and management all around the world. You can learn more about Cities Changing Diabetes by going to citieschangingdiabetes.org. The purpose of this live stream is to help people living with diabetes and their caregivers. And today we're talking about the lived diabetes experience, especially eye health. Leave a comment, share where you're calling us from, and don't be shy. Join the conversation. So let's welcome our guests. We have Dr. Victor Gonzalez, ophthalmologist. Good morning, Dr. Gonzalez. Thank you for taking time out of your day.
Good morning, Joy. It's a pleasure to be here. Thank you.
We also have Serena Valentine, CEO, Core Initiatives, Houston Peer Support Leader, and Cities Changing Diabetes Core Team Member. Good morning, Serena. And we also have Lisa Golden. She's a diabetes program specialist working with the Texas Workforce Commission. Good morning, y'all.
Good morning.
Excellent. So thank you all again for making time for this important discussion on eye health. We've all resolved to share some actionable goals for our viewers living with diabetes and then for anyone caring for them so that they can safeguard their health. Dr. Gonzalez, before we come up with some concrete steps that our viewers can take, I'd like you to take a moment to help us understand the advancements in medication therapies that have changed the way that the field can address eye health concerns. Diabetes eye health today is so very different from what all of us here and many of our viewers knew 15 or even 10 years ago. Isn't that correct?
That is correct, Joy. The advancements that have occurred as we understand the chemical messengers involved in the development of the complications in the eye have really helped us combat that problem. In the past, we used to think that the only treatment was laser and or surgery. But as we've learned from the large studies, the first and most important treatment is control, right? The big studies indicate that the better controlled you are, the better you can control this. As the disease advances, we now have some very important medications that we can inject into the eye to reduce the chemicals that are causing the problems in the retinal vessels and the detachments that used to occur. The importance here, Joyce, is that the timing is very important and to be consistent, because if we can apply these medications now, the incidence of blindness due to diabetes can dramatically be reduced, if not eliminated.
That's fantastic, Dr. Gonzalez. I know that I grew up living with family members with diabetes, and that's one of the chief concerns, right? and knowing now what we know and what studies that you've taken part in have learned about eye health and how we can prevent things from going too far is very, very important. Today, Serena, she has had her own journey with diabetes-related eye disease. Serena, would you like to tell us a little bit about your journey and how it's influenced the work that you do now, and just kind of how uplifting knowing that this journey is different for others has been? Oh, we can't hear Serena. Well, I think we can come back to you. I think your perhaps your audio is off. So while you do that, I think we'll segue over to Lisa while Serena fixes, live show, y'all, the audio. Lisa, can you tell us a little bit about your work at the Texas Workforce Commission, how you got involved in diabetes and the special role that the Workforce Commission plays in the life of someone living with diabetes and living with a disability?
Yes. Can you hear me okay?
Yes.
I got involved in diabetes about 25 years ago, working as a diabetes clinical coordinator for a home health agency. And it was a wonderful learning experience. I had two incredible mentors who were certified diabetes educators, and I really realized the impact that diabetes education had in the lives of individuals. And then about 10 years ago, or just over 10 years ago, I applied for a job, and I didn't really realize what I would be doing because I had never heard of vocational rehabilitation. I just knew I knew a lot about diabetes. And vocational rehabilitation is a program that's available in every state. In Texas, it's currently under the Texas Workforce Commission, and we have a vocational rehabilitation division that provides services to people with disability who want to obtain or retain their employment. We really prefer that people maintain their employment or regain employment. When people think that when you have a disability that you can't work, and that's not true, and work is so much a very important part of our lives. And with diabetes being the leading cause of blindness in many working age adults, we needed a program to address that underlying cause. And so that's the program that I work under, is helping train diabetes educators in how to work with individuals with blindness or deaf blindness or other severe disabilities. So some of the other disabilities may be like loss of hearing or an amputation, a mental illness. There's all kinds of disabilities that we could possibly work with, but blindness is the primary disability that I work with.
Wow, this is really important, and I think especially timely now to understand that there's ways to prevent eye health sort of deterioration and disability. But if there is a situation in where you find yourself in maybe limited vision, there are places that individuals can go to help. Dr. Gonzalez, I wanted to get your input, and I know we spoke about this previously, but I recently read in an article that complications or advanced diabetes disease is increasing, related to delays in care during this pandemic time, or people thought they could put off their visits just a few months, and now it's become almost a year. What is your message to individuals who perhaps feel like there's nothing wrong with me now, maybe I could just wait until this is over?
One of love to use analogies. And I think an analogy is very appropriate here, which is very simple. I'm very simple. And the answer to your question is this: if your house is burning, okay, if you have a fire, do you want to put the fire when the first wall is caught on fire, or do you want to wait till the last wall is caught on fire? And in a sense, diabetes in the eye can be like a fire. And the sooner you turn it off, the more functional vision you'll have. It's like, having a little burned in the wall in one house versus all four walls burnt down. So it's very important for us to make sure that we understand that process is there and it needs to be taken care of. The timing, the studies have indicated that without a doubt that the earlier we intervene, the more of the vision we can preserve. And you do not want to wait till you can barely see the big E on the eye chart. You want to get treatment while you're still 20/20, and we can preserve you there. And the studies now are very clear. Ophthalmology has had very intensive studies, multiple years, multiple drugs. There's no doubt that early intervention is the best result, long-term, short-term, and intermediate. So for those of you who are concerned, rightfully so, about showing up to the doctor's office because of COVID, be assured that the eye doctors have taken special precautions to make sure that you're safe, that they're safe, and that we can provide you with this treatment as soon as you can come.
Agreed. Let's see if Serena has, can we hear you on audio, Serena? We may have to have you log in maybe by your phone, because I think that your experience while living with diabetes and eye health concerns, and then also Serena continued to work throughout that time, and she continued her diabetes advocacy and went to meetings with us, and she really did not take it as her reduced vision as something that she could not overcome. She just went full-fledged in. And so in that way, she is both a very strong advocate, an incredible peer support leader, and a fighter. So, and a true diabetes warrior. So when she gets her audio in, I want her to tell you all her personal story.
Julia,
and in the meantime,
while we're waiting for Serena, I just wanted to discuss a few of the steps that have been taken in order to help give confidence to the patients to come in and also the doctors, because as you can imagine, as we learn more about COVID-19 and how to protect ourselves from it, we've realized that there's some very straightforward steps that can be taken to both keep the doctor safe and the patients safe. We all know about wearing masks. This is very important, and we need to continue with that. But now the doctors are comfortable, so they're opening the clinics, and what we're doing is we're spacing patients out. We're following the social distancing in the clinics. We have extended to Saturday morning hours, so like that we can cover the number of patients that need to be taken care of with extra steps. So I think, the steps are there. I think the doctors are committed to make sure that, of course, they keep you safe and themselves and their staff safe. It's time for us to make sure we encourage you to come back in, because we need to continue taking care of that valuable vision you have.
Mm-hmm. And Lisa, how is the Texas Workforce Commission responding to COVID-19? What are you projecting in terms of services needed, I guess, while we're still in this, and then also after we found some sort of resolution?
Well, Texas Workforce Commission has done a wonderful job of being able to shift and provide a lot of services remotely. So that happened very quickly back in March, and we've received a lot of training so that we can provide a lot of virtual services. Not everything is how we might like to do it because, like, particularly working with an individual who is blind, sometimes hand over hand is the best way to work with them. And of course, we can't do that, but we have learned how to describe things a little bit better. We're providing a lot of classes remotely, and some wonderful technology classes, vocational evaluations, counseling and guidance so that people can, and people are getting jobs with disability and despite COVID. So we've shifted very quickly to that. We are anticipating some COVID-related disabilities or repercussions. So there may be a surge coming in 2021 of people who have overcome COVID in one ways, but are still living with some COVID-related disabilities. And we would love to serve those individuals.
Excellent. So the work does keep going.
Yes.
For sure. Serena, there you are.
Can y'all hear me now?
Yes. Hello.
Oh,
And
goodness.
so Serena, Lisa was just talking about how the Texas Workforce Commission has pivoted to online and still providing care for individuals who need it. Can you tell us a little bit about your journey and how you were able to overcome disability, diabetes, eye health issues? Tell us a little bit about your journey.
yes. Well, this was a part of it because I had to look in the chat to see what to do. And it took me a while, but I made it through it. About almost 3 years ago, I started having issues with my eyes, and I had not been able to go to see an ophthalmologist because I didn't have health insurance to go see one, and I didn't have the money to pay for it. But I started having floaters in the right eye and light sensitivity, and so I went there, found out that the retina was detaching from my eye, and it was due to diabetic retinopathy. And so this can become a long story. Lots of surgeries, like laser surgeries and other surgeries in both eyes, because then the left eye started deteriorating. February 3rd will be 2 years that my right eye has been completely blind. Last year I had I was technically blind in both eyes. The right eye was completely dark, and the left eye, all I could see was light. And yes, it was very difficult. Those are my CCD colleagues that would sit with me in meetings and events and stuff. Had to help me, walk me around sometimes, and I appreciate y'all for that. But trying to thinking about, well, I want to continue to work. I'm a single parent of a special needs child, and me thinking that I could not work because I could not see, and me not being able to do that, it kind of takes away a little self-worth. Well, to that person, everyone else around you may not think that, but to yourself, it's most important about how you think about yourself. And so it does take away, it feels like it takes away a little self-worth, because it's like, oh, I can't do anything. I remember I mentioned on the 25th episode that I was volunteering with CCD, and I didn't want to tell I didn't want to tell Klaus that I was having problems with my eyes, because I want to still be able to continue to work, and I didn't want anyone to think that I was incapable. That's another thing. It makes a person think that they're incapable and they're not able, and it kind of brings you down. You deal with depression and anxiety, and you kind of have to deal with things even when you're by yourself. Everybody's like, oh, you're gonna be okay, and it's like, yeah, but you're not there with me. But it has helped me to actually add to my story when I talk to other people who have diabetes, and I tell them, this is something serious. I personally had no idea that diabetes affected the eyes this way. I knew about the amputations. I knew about the liver, the kidneys, the heart. I had no idea about the eyes. And so it was an eye opener, for lack of a better term, for me to be able to share with people, because a lot of people don't know that, and it's important for people to know that diabetes does affect the eyes. And when I was still doing peer support meetings in person, nobody knew it until I told them, and I said, this is a good reason to keep your blood sugars regulated. I said, I cannot see you all's faces. I know you're here, but I can't see your faces. And so they were like, what do you mean you can't see our faces? I said, I can't see your faces. Keep your blood sugars regulated so that your eyes can stay intact. And they're like, oh my gosh. Like, you know, so it's been helping me with a story to tell others how, you know, yet another reason to keep blood sugars regulated.
Yeah. And so this is a really good, I think, bridge to show the interconnectivity, right? So Lisa is a certified diabetes care and education specialist like me, and we do our best to inform and give information and make sure people are going to their appointments. But there's something to be said about the peer-to-peer community support that reinforces that message, right? So from one person living with diabetes to another person living with diabetes, there's nothing so much as walking sort of the path together to reinforce the things that Lisa and I are teaching, and the care that Dr. Gonzalez is providing then in the community. Thoughts, Lisa, Dr. Gonzalez?
Yes, you know, first of all, that's a very common frustration what Serena has experienced, and you know, just to put everything on the table, whether you have type 1 or type 2 diabetes, you know, you have the same risk, and we need to make sure that we get everybody to be evaluated. Okay, so type 1, type 2, you have the risk of eye disease and all the other complications. We need to have you come in. You know, the frustration is having treatments that, as I pointed out, very effective treatments to control diabetic retinopathy, and having people not have access. Okay, and this unfortunately affects people across the board. If you're uninsured, you know, as Serena gave you the example, you know, it doesn't matter where you're from, whether you're black, white, yellow, red, it affects us all. But unfortunately, there is a disproportionate number of people of color who are impacted by this. And it's unfortunately related to the fact that we have a very large number of people who are uninsured or poorly insured. And this is something that's very frustrating. Just because you have an insurance policy for healthcare doesn't mean that you have access. And what do I mean by that? Well, sometimes the copays are so large that people can't afford to go see the doctor, even though they have the insurance. So for those of us who have the ability to treat individuals like Serena, it's so frustrating to not be able to get to them in a timely fashion. And we need to continue to work. And Serena, thank you for all you do, because you're right. The peer-to-peer interaction is so important. And when I go to state capital or the national capital, you know, I need people like you to help me, because people need to realize what's happening.
Mm-hmm. Definitely.
And there are some streams and resources for individuals. Like you said, there are people who are resourced and even people who are under-resourced. Some insurance plans or benefit plans may not include eye health benefits. Keeping in mind that open enrollment ends on Tuesday for the marketplace. So if you are underinsured, under-resourced, just, you know, find resources and reach out to your clinic, community health workers, your certified diabetes care and education specialists, your case managers, and see how you can perhaps gather resources around yourself. Available, well, I guess a resource access you can go to is www.healthcare.gov. Okay, and we'll get that up in just a moment in case you missed it, in case you're a visual learner. So can you all tell me a little bit more about the sort of the progression of eye disease? Because I know that some people need to see it as well as hear it. And I know, Dr. Gonzalez, you had planned to show us a little bit.
Yes. So I'm going to ask you, if you can, to put up the slide, so I can give you a few tips that I think are going to be important. Now, this is just a picture, that shows what the back of the eye should look like. And if you're looking at it directly, the upper left shows you an orange little picture, which is what normal should look like. And as you progress into that blue square, you start having now a retinopathy that becomes, in the treatable retinopathy. And as you continue forward below, you go into that green box, and that's the severe. And we want to catch you before that blue box. And the way we do this is for us to make sure that you come in a timely fashion. So here, it doesn't matter if you're type 1 or type 2. If you're type 1, we usually know when that event happens because it's an acute event. And the first eye exam is recommended within the first 4 to 5 years after diagnosis, and then every year after that. If you're a type 2 diabetic, you may have had retinopathy and not known it. So those individuals need to have an eye examined as soon as they're diagnosed, and then every year after that. I think the important message here is that, remember, type 1, you need to have your exam within 5 years. Type 2, you need to have your exam immediately after diagnosis. And then after that, either a yearly exam if you're not having any severe retinopathy, or the doctors will determine how often you need to be seen, especially if you have retinopathy within the blue or that green box.
Super. Thank you for explaining that to us. And I know that Serena had a question. Do you remember what question you were asking me, Serena, regarding symptoms or signs?
So when I heard you say earlier, Dr. Gonzalez, that it sometimes you can, if you catch things even before you even see a symptom, there's things going on behind the eye before they really, you're able to have the symptoms for it. So when is the perfect time to go see an ophthalmologist? Say you went to see your eye doctor and they said everything was okay, but then you start seeing the floaters and stuff like that. But some people will be like, well, I'll just wait till the next one because I can still see. But is it important for them to even make another appointment even before the next one?
Serena, that's a very good point. And this is something that, we always try and fight. I mean, if you notice when I gave the examination requirements, nowhere there did I say when your visual acuity is affected or when your vision drops. So the answer is definitely you want to make sure that you go and have your exam, as I mentioned, for type 1 within 5 years, for type 2 immediately, regardless if your vision is 20/20 or not. Okay, you need to have that exam. And then you need to get examined every year, even if your vision is okay. A simple check for glasses is not a diabetic eye exam. That's very important. You need to go and make sure that your eyes are dilated and that they look in the back of your eyes. So that's number one. Now, once you start having symptoms, which is what you're referring to, anytime you start having unexplained blurriness of your vision that doesn't require glasses, or as you pointed out, when you start seeing floaters or spots in your vision, that could mean that you're bleeding in the eye. Okay, so any increase in spots in your vision Or if you all of a sudden notice that you can see clear out of one eye, and with the other eye, it looks like someone smeared, some grease on your glasses, and then, that means there's some swelling potential in the eye, and those are urgent consults. Not that's no longer a let me see when I can get in. You need to get in urgently to see an ophthalmologist in that case.
Mm-hmm. And it's funny you mentioned that, because I the whole time I was going through the retina being detached and everything, they were still saying my vision was 20/20, and so I was like, well, wait a minute, I don't understand. I thought it was supposed to be, I thought my vision, because I thought the vision was connected to how the retina was in my eye, and I was confused at first. But that's a good point you bring up. Even if you have 20/20, you could still be having other issues in the eye.
That's correct.
Yeah.
Awesome. So I love that explanation of prevention is first. Continue your visits, and then if there are any sort of progressive stages that you're talking about, then call for an emergency visit.
And I think Serena pointed that out correctly. I mean, her concern about the fact that the vision was also good is correct, because your vision is going to remain 20/20 even if you have severe advanced retinopathy, because as long as the central vision is attached, you can have a retinal detachment, as she pointed out, around it and still have 20/20 vision. This is why it's so important, and I know I've said it once, and I want to re-emphasize this. A simple eyeglass exam is not a diabetic examination for this exact reason. You can have 20/20 vision and have your retina detaching all around your central vision. And that's the time we want to catch it, before the central part is detached, because then, as Serena pointed out, even though we reattach it, it doesn't come back to the same level.
Lisa, you had a comment?
Yes, I also feel like, type 1 diabetes, there's usually a very big event that leads to diagnosis. But with type 2 diabetes, the symptoms are often silent. And sometimes it's eye professionals that are recognizing that there's damage from diabetes, and that's how they are getting diagnosed. So we do have to be especially vigilant if there is a history of diabetes in our family, on making sure we're getting diabetes tested and we can recognize it in the pre-diabetes stage, and have some interventions like healthy eating, being active, and maybe some medications that can help us. And especially once you are diagnosed with diabetes, that you receive some diabetes education so that your lifestyle can be built into the diabetes management, and it'll make it easier for you to do those healthy activities that are necessary to manage diabetes.
Excellent. Great point. We, I think, are often very grateful to not only to primary care, but to our specialty physicians, OB-GYN doctors and ophthalmologists who notice the complications and sort of like the derivative symptoms of diabetes, and then help lead to a type 2 diagnosis. This is a really good place, I think, for a question from Marianne. She says that, and this is a question that I oftentimes get to, that if vision is blurry at new diagnosis, should I get new glasses immediately? That's a question for you, Dr. Gonzalez.
Well, at new diagnosis, as I pointed out, if your vision is blurring, you need to make sure that you first of all get to see an eye specialist to look in the back of your eye. Okay, there are a few reasons why your vision can be changing. The lens in the eye is bathed by fluid that reflects the blood sugar levels in the eye. That's why diabetics can sometimes develop cataracts sooner than the normal population. When we rapidly control your blood sugar levels, the thickness of the lens changes, and that changes the need for glasses sometimes. So when you're in that transition phase, don't go and spend a lot of money on glasses. First, let your blood sugar stabilize, and then go and get your glasses changed. Otherwise, you'll be spending some extra money as you're normalizing your prescription changes. Okay. So yes, that's a good question. That's a good point. You may see that might be normal as your blood sugar is improving. One of the misconceptions that happens sometimes is that patients will not require glasses, and then all of a sudden you give them the medications to lower the blood sugars, and then all of a sudden the need for glasses is unmasked, and the patients are saying, "Oh my God, that medication is causing a problem." No, that's really where you are once you're normalized. The blood sugar is giving you a false correction that long-term will result in damage to the retina. So do not be afraid if you use your medication and all of a sudden the need for glasses is unmasked. That's your natural state. And that's where you want to be, even if you need glasses, because long-term, that's what's going to protect your retina.
Super, thank you. And we just pulled that up there. So waiting until your glucose values stabilizing, and then move into decisions about eyeglasses and things like that. Thank you very much for that. It's very clear. So Serena, I think you had another question, if you can remember it, for Dr. Gonzalez. You had really good questions about prevention and treatment.
I got good questions because I got a lot of experience. Yeah, okay. So when I talk to people in peer support or outside of peer support, because I can meet someone in the store and they have diabetes, I will have a long conversation. Okay, that's just my nature. But I've had people ask me, so if I have diabetic retinopathy, is surgery automatic? Like, is that the first line of defense, or is there something else that I can do besides surgery? Because everyone's kind of scared of surgery, because you really don't want anyone cutting on you, and then you don't want anyone cutting on your eyes, So a lot of people ask me, is surgery the first line, or is there any other treatment available?
Well, Serena, you're great point. I mean, and there is a transition of treatment, and they're all very important. I train retina specialists here in our program, and my question to them is exactly that: what's the first line of treatment for diabetic retinopathy? And right away they jump into injections and or laser, and that's not true. The first line of treatment is control, and that's probably the most important. So we need to make sure that Lisa and Joy and everybody who's involved in educating our diabetics, get involved, because that is the first line of treatment, and it's a very important line of treatment. And the studies clearly indicate that if you have retinopathy, you control yourself, you can improve it. If you do not have retinopathy, you can delay the development. So it's very important. Now, once retinopathy begins to develop, there are some medications that we use. Those are the injections that I was mentioning earlier. Again, they work best early on, and this is why screening is so important in this country. And we still have a lot of work to do with early screening in our diabetics. Why? Because I'll give an example. I have diabetics right now who are in my early treatments 15 years ago with severe retinopathy. Their incidence of legal blindness in the 3 years following their diagnosis was almost 95%. And we gave them the medication. 15 years later, they require one booster injection a year. And those individuals we've been able to keep at right around 20/25 vision in both eyes. So again, we have the data that indicates what needs to be done. problem is access. Like Serena pointed out, we need to make sure we give everybody the access because the treatment is there. Now, surgery is a step. Laser is simple. Laser, we combine it sometimes with the medications to decrease the number of injections that they need long term. But if the retina is detaching, as you pointed out, Serena, we do need to have surgery, because the reason why we need surgeries is the unique anatomy of the eye. As the retina needs to touch the wall to receive its oxygen, and 50% of the oxygen comes from that, and 50% comes from the vessels in the retina. And if the retina detaches, then you're cutting 50% of its oxygen. That's why we sometimes need to do surgery. The second reason why we sometimes need to do surgery is if the eye gets filled with blood and you can't clear it, we need to evacuate the blood so that the images can come into the eye without obstruction.
Super. Thank you, Dr. Gonzalez. You're such a great teacher. So I have another question for you coming from our guest, our viewer. What is sorbitol in the eye, and can this go away?
Well, see, this is part of the chemical cascade that happens in the eye. Okay, I won't go into a lot of detail, but I can tell you there are a number of chemicals that have been identified that can cause problems in the eye, and that's one of the markers of a problem. The other one, and the one we have the most treatment for, is something called vascular endothelial growth factor. Won't get fancy here. Just know that it's a chemical that builds up in the eye that causes the blood vessels to leak and to grow. And it sounds good if they grew where they were lost, but the problem is that we need to decrease that chemical. And the injections are like a big sponge. They go in there and absorb that chemical. It lowers that level, giving the vessels an opportunity to repair. That's the good news. The bad news is that it only lasts 4 to 6 weeks. That's why you have to give it every 4 to 6 weeks. And it's not unusual for us to give diabetics 6 to 9 injections the first year. But if we're persistent and we continue, we can preserve vision. We can modify the disease so that the second year they need maybe 2 or 3 injections, and the third year and beyond, maybe 1, as I pointed out to you. But again, timing is important. What the studies indicate, that the sooner you begin those treatments, the more likely it is that you'll preserve the vision that they have at the time of presentation. So again, COVID's been a challenge, but we have a way to meet that challenge. Come in and see us. You'll be safe.
Wow. Dr. Gonzalez, that's so awesome. So Dr. Gonzalez says, please come in, take care of your eyes. There are medications that can go in, and I love your explanation, something really easy to understand. They go in, they provide a sponge to remove those perhaps damaging chemicals that can build up. You can reduce those, and by that, allow your blood vessels to repair themselves and save and reverse eye disease, depending on when you are able to catch it. That's fantastic. I'm not sure that I've ever, sort of seen. I feel like I'm at an eye continue education session built just for those of us who don't know that much about eyes. So thank you so much for doing that for us this morning. And Lisa, I know that you were wanting to talk a little bit about some programmatic items. So now that we've all been educated, and can you share with us the things that your team is doing?
Well, I mentioned earlier about our vocational rehabilitation program, which helps individuals with disability get back to work. But there's another segment of the population that we serve, and that is those 55 or older who have blindness issues. So it's the independent living services for older individuals who are blind. And those are individuals who want to remain in their home, but they need some services because when you do lose vision, it makes every single life activity more difficult. And so this program allows a caseworker to work with that individual to give them some resources and ideas on how to remain independent, remain exactly where they are, or at least where they want to be. So again, they could call that 1-800 number, or I'm sorry, it's a 512 number in Texas in order to learn about either program, the vocational rehabilitation program or the older individuals who are blind program.
And then across the country, you were saying that there are programs in different states as well.
Yes, those same two services, it's actually a federal grant with state support. And so those two services would be available in any state. And so I would just Google your state and either older individuals who are blind or your state and vocational rehabilitation.
Okay, super.
Joey, may I comment on Lisa's? Lisa and a department like hers play a very important role for us, and this is for the public in general or other eye care specialists that might be listening to this broadcast. I mean, I think it's very important for us to have that continuum. And what do I mean by that? Well, part of the treatment is once you stabilize your patient, making sure that you provide them with the information that's necessary to give them that functionality that Serena was talking about. The if they're having that doubt about what they can or can't do, we are very important resources, and people like Lisa can really help us. If your vision's been impacted, she pointed out, you can have large font on your computer. We also have low visual aid evaluations to help them with either magnifiers, or now we have some very nifty electronic systems that can allow the contrast to be changed. And just think about your iPad. You can have something there regular, and then you can use your fingers right and bring it and magnify it. And that's been it's opened up the world to a lot of my patients who have had significant vision loss, because everything from reading the Bible to reading their correspondence. People like Lisa have helped us have access for those individuals, and many of them have become very productive individuals at work. And I never hear the praises for vocational services like the types that Lisa runs. And it's correct across the country. If your docs are not familiar with it, please look into your state's vocational services, like the ones in Texas, and let your doctors know, because I think that's very important for us to continue to do what we can to increase the function for our patients.
Mm-hmm. And here in the Med Center, I've worked before with the nurse case managers at the Eye Institute to develop different ways for individuals to even do meal preparation. So, and there are different ways that you can choose different color plates and different utensils, and just all of those types of ways that, and I have family members who have been affected, and so those things help to bolster self-efficacy or feelings of ability, so that you don't lose your abilities to do the things that you want to do. And as we say here at MyDiabetesHQ Live, thrive with diabetes, not just live with it. So that's super. Thank you guys for all the work that you do.
Can I say
Serena?
something right quick? I can never leave anything as it is. Just what I've told today, just about my problems, but I do have a silver lining. Things can change. I know if anybody's out there watching this show or just listening, because I understand, just don't think that because your vision is severely affected or impacted by diabetes, that nothing can change. Like now, yes, my right eye is still blind, but I have my vision has improved some in the left eye to where I can at least get on the computer. Yes, I have some of those assistive technology, different kind of programs on my computers, on my phone, and things like that. But it's better, much better than it was last year. And when I had no vision, let me tell y'all something. When Dr. Gonzalez said the first line of defense is to get your blood sugar under control, that is definitely the first line of defense. When I say, some of my family thought I was crazy. I had a spot in the house where I cleared out. I would exercise just in that spot. I couldn't go do a walk or a run because I couldn't see, but there was a spot in my house where I would exercise. I still paid attention to my food, what I ate, and I still tried to keep my stress levels as minimal as possible at that time. So things can change. It doesn't have to be that way. And as soon as you okay, I have one eye that's blind, it still is not over. Your life is not over. You can still, as Joy said, thrive with diabetes, even if your vision is severely impacted. And I'm living proof of that. So I just want to share that little glimmer of hope. I didn't want to leave it as, oh my gosh, my eyes, they're bad. My life is over. No, it's not. It's not.
Mm-hmm.
And thank you, Serena, for that powerful message to others. Even if you have been impacted, there's ways to take care of yourself through programs like the Texas Workforce Commission, and through treatment and care, continued care with clinicians, physicians like Dr. Gonzalez and his team, because I look over at the side of my screen here and I just see the passion coming through from all of you. And so I know that people are being given that sort of all the way around 360 care for their vision and their disabilities. It's fantastic. And I just want to revisit some tips from the Association of Diabetes Care and Education Specialists, whose article on advancing diabetes disease during these times really brought us to ask you all to be here today. And so if we just take a look, we want to remind everyone to stay active, stay alert, and stay in contact with your clinics, with your physicians, with your educators, with your peer support leaders. We have not left. We are still here, and we still want to take care of you. Monitor your glucose levels, choose healthy behaviors, and go to your appointments. Be aware of your A1C changes. Additionally, consider telehealth options because physicians and their care teams are taking care to protect you during this time through masks, physically distancing people coming in, and also just as Dr. Gonzalez said, today is Saturday. He's taking time out during his visits this morning and this afternoon to be on the broadcast with us. But they have spread out appointments so that individuals aren't in the same space at the same time. And then pay attention to changes in your eye health. Even after taking preventative appointments, if things start to change, call your clinician and ask for an appointment now. Super. Did I cover it okay, y'all?
Joe, you did great.
Excellent.
Any additions for us, Doctor? Oh, well, I did have a question for you before I let you go while you're here to do my continuing education here and be my professor of eye health. Related to, so we know diabetic retinopathy is a disease progression in diabetes. What about glaucoma or cataracts? Can you kind of explain a little bit how those two things may or may not be related?
Today we just focused on diabetic retinopathy, but all diabetics are also at risk of developing glaucoma, which is loss of the nerve fibers in the eye as a result of a neuropathy. So glaucoma is, everybody just thinks of pressure, and yes, pressure is important, but glaucoma is a neuropathy. So diabetics have neuropathies, right? That's why our toes can become numb. That's why, we can have changes in the retina, because the retina is a nerve. So glaucoma is also something that needs to be monitored and treated in diabetics. And because the lens is bathed by a fluid that reflects your blood sugars, as I pointed out, the sugar level increases and decreases in the eye, which causes water to come in and out of the lens of the eye, and that can increase your risk of cataracts. That's why cataracts are also seen early on with our diabetics.
Super, thank you. So I want to thank you both for being here today, and I hope that you know that I'm not sure if you know about the sort of the promise of being on the MyDiabetes HQ Live broadcast. It means that you've joined the family and that you're invited to dinner again and again and again. So just an awareness, we're just going to let you know that that we will call upon you likely soon to have more conversations, because we have just greatly appreciated this time that you've given us today. Thank you so very much.
Thank you all for all you do. This is a great program, and my patients, I'm sure, will benefit from it. Appreciate it.
Yes, thank you for this opportunity. And like Serena says, people with diabetes and people with vision loss can thrive. So, just take advantage of every opportunity you have and every professional like Dr. Gonzalez that you have access to.
Serena, did you want to say anything else?
I want people with diabetes to know that no matter, we're talking about the eyes today, but there are other complications that people with diabetes experience, and just your perspective. Don't think that your life is over. Just don't, because I see that a lot. Even during this pandemic, it kind of compounded some things for a lot of people with diabetes. And I spend a lot of time talking about the mind. So I just want people to just, relax. Please go see your doctors. Please go see your doctors. Don't hesitate. We go to the grocery store, we go other places and things like that. So that should be on the top of the list, is going to go get your checkup. So please continue to do that.
Thank you all for being here. Thank you for such an important message today. So for our viewers, we do have a quick survey on YouTube and Facebook where we would like to get your feedback on the program as well as recommendations for future episodes. Please make Diabetes HQ Live better by filling out the survey. It's been a great start to our Saturday morning with my passionate and compassionate colleagues. To our viewers, we hope that this conversation has encouraged you to take care and to grab a hold of your own eye health, or share the information that you've learned with someone that you may know is battling eye concerns right now. Mark your calendars. We will be broadcasting every Saturday, 10 a.m. Central Time and 11 a.m. Eastern. Join us next Saturday. And thank you once again for being part of the MyDiabetes HQ Live community. See you next time.